So I'm going to present on some of the results of our scoping review of social norms interventions. And as you see, this was part of a larger project, part of which Professor Ilona Tosca has touched upon here. I work with the Accelerate Research Hub. We're a partnership of researchers across the universities of Cape Town and Oxford, where I'm based. But this work also received, we worked with colleagues at UNICEF Eastern and Southern Africa, the Together for SRHR partnership, and very key was a part of our key informants was the United Movement, members of the United Movement, who I know Faith is here. I haven't met several of you in person, but big shout out and thank you to all of you for participating. This project had kind of two main goals. One was around mapping the network of social and gender norms affecting sexual reproductive health outcomes amongst young people, which was part of the slide with the different norms that Ilona showed previously. But this review in particular had a focus on what works. So how do we address some of the social and gender norms through interventions to improve sexual reproductive health outcomes. So our review included 40 quantitative evaluations of 36 programs. A key challenge right at the beginning is what is a norm shifting interventions, right? So we worked with this working definition around interventions that seek to change some of the socially shared rules, determining what's acceptable or appropriate within a certain group. We selected interventions that address social norms, but that had measured an outcome in terms of SRHR. Several of them didn't actually measure changes in norms and attitudes, so a bit of a gap there. Another key challenge is that a lot of these programs were delivered in combination, so we're not quite able to evaluate what is the effect of individual components, and they were often combined with kind of economic support or healthcare service delivery interventions. This is a very comprehensive table, which I don't expect you to be able to take in just at a glance, but we kind of captured all the effectiveness of the interventions. Across the rows, we have the different strategies or kind of entry points for social norms interventions. I don't think you're able to read it, but some of the most common ones were around school-based SRH programming, life skills or safe spaces, community-based dialogues, media or digital approaches, and so on. And we had a range of outcomes as well there across the columns there, but we kind of split them up in six key areas around violence prevention, child marriage prevention, HIV and STIs, sexual risk behaviors, adolescent pregnancy, and contraception and family planning. So this is just for us to, I guess, visualize a little bit around the positive, negative, mixed or null results. The solid circles represent kind of individually delivered interventions. The hollow circles are showing combined effects. So just kind of be able to see where most of the evidence is, where we can, I guess, spot a bit on where a lot of the positives are, a lot of the nulls are. Besides looking at the effectiveness of interventions, we also wanted to think about the process of norms change. So we created this framework that is inspired by previous work of the DFID Voices for Change program and the Social Norms Learning Collaborative. So we set out kind of 10 core key attributes of social norms interventions and organized them across these three key elements of social norms change. The first of them, I won't go into all the attributes, of course, but just some examples of what these could be. So the first one around changing social expectations of what others do or what they approve of. This may include promoting positive new norms by prompting kind of reflection on identifying some of the healthy relationships in your lives. What are some of the positive characteristics around those, and discussing. Publicizing and diffusing change, the second element. So a diffusion strategy may be done through mass media or digital approaches, but also could be done by kind of inviting intervention participants to share their experiences forward with members of their communities or their peers. And then the last one on catalyzing and reinforcing change, this may include improving access to healthcare services to kind of offer and reinforce the opportunity to exercise new health-seeking behaviors. And I should say we assessed all the interventions across these 10 attributes, and what we found is that interventions that had attributes across the 3 elements were more likely to be effective. And then some of the key learnings from the successful interventions that we found. So we see strong evidence of interventions addressing social norms on reducing violence and child marriage rates, increasing HIV testing and condom use. And in particular, in terms of approaches, we see evidence of life skills, media, and community-based approaches as effective. It was important that these interventions kind of build on existing platforms already used by adolescents and young people or their reference groups, and engage in their reference groups. So these are kind of the people whose opinions it matters to adolescents and young people, and they're deciding whether to engage in a behavior. So this could be obviously like parents, peers, but also members of your community and so on. This was really crucial around interventions having interactive activities through a structured curriculum. And often this norms kind of content was combined with some more practical knowledge about sexual reproductive health, about life skills. The interventions that were effective often promoted positive new gender norms, prompting the critical reflection on power roles, gender inequities, youth sexuality, and the rights of young people. The effective interventions often were facilitated by local members of the communities. They were selected and trained not only in facilitation skills, but also on having positive gender equitable attitudes. And this was really important for the interventions being delivered and all the sensitive content being delivered effectively. And lastly, the importance of a multi-stakeholder approach engaging these reference groups, not only for reinforcing and diffusing the message, but also avoiding backlash for adopters of new norms. And that's all. Thank you.